Hollywood cigarettes versus real cigarettes. Psychological analysis with inclusion of tests, pros and cons, and quitting strategies. In many Hollywood scenes and films, fake cigarettes are commonly used, which are entirely harmless or made from substitute materials. The use of real cigarettes in films can pose several challenges. 1. Actor health. Using real cigarettes can harm the health of actors. Cigarette smoke contains harmful and toxic substances that can affect the health of actors and associated staff. 2. Environment. Using real cigarettes can worsen air pollution and workplace environments, creating environmental issues. 3. Health and safety regulations. In many countries, health and safety regulations regarding smoking in public and work environments exist. Using real cigarettes in prohibited areas can lead to legal issues. For these reasons, films often use substitutes like nicotine-free or herbal cigarettes. These cigarettes may resemble real ones but lack harmful substances. Additionally, special effects and technology can enhance the visual appearance of cigarette smoke in the background. These methods allow filmmakers to create necessary visual effects without harming the actor's health or causing environmental problems. Smoking has long been associated with certain characters and scenes in the Hollywood industry. Over the decades, characters in films and TV shows are often depicted as smoking. This can have various effects on society and culture. 1. Modeling. Characters and actors in films and TV shows are considered social role models. If these characters are shown smoking, it might influence some viewers and encourage them to smoke. 2. Character association. In some cases, characters' identities and personas might be associated with smoking. For example, in a story set in the past, characters are often shown smoking to reflect a particular era. 3. Emotion portrayal. Smoking by characters can portray their emotions and mental states. For instance, smoking in stressful situations might emphasize a character's mental state. 4. Storytelling. Smoking by characters can enhance the storyline or add complexity. It can represent addiction or contribute to a character's life experiences. 5. Visual appeal. Smoking can sometimes enhance visual aesthetics and effects, creating beautiful and exciting images. However, it's important to remember that depicting smoking in films and TV shows is not necessarily promoting smoking. With increased awareness of the health risk of smoking, the number of scenes depicting smoking has decreased in recent years. Cigarettes are composed of various substances that create smoke and have different effects when burned. The main components of cigarettes include 1. Tobacco. Tobacco is the primary component of cigarettes, used to create cigarette smoke. These dried plants contain harmful substances like nicotine, tar, and carbon monoxide. 2. Nicotine. Nicotine is a psychoactive substance found in tobacco that affects the nervous system. It can lead to increased heart rate, elevated blood pressure, shortness of breath, and nervous system stimulation. 3. Tar. Tar or tar compounds produced when tobacco is burned can harm the lungs and respiratory tract. 4. Carbon monoxide. This substance is produced in cigarette smoke and binds to hemoglobin in the blood, potentially reducing oxygen supply to body tissues. 5. Ammonia. Ammonia is added to increase nicotine levels in tobacco and can contribute to nicotine addiction. 6. Other harmful substances. The combination of tobacco and cigarette additives contains other harmful substances, including nicotine analogs and compounds that form various tar combinations. Considering these harmful substances in cigarettes, their consumption significantly affects health. Hence, quitting smoking is strongly recommended to improve one's health. Various psychological perspectives exist regarding smoking. 1. Delay in quitting. Some psychologists propose that many individuals delay quitting due to cognitive and social factors, like self-confidence, misperception of real health threats, and social pressures. 2. Habit and smoking connection. Some psychologists believe many people continue smoking due to the habit and a strong association with smoking. This connection can serve as a tool to reduce anxiety or alleviate stress. 3. Unconscious mechanisms. Certain studies suggest that unconscious mechanisms can significantly influence smoking behavior. These mechanisms may be affected by the need for control or reduction of anxiety and stress. 4. Smoking as a reward or bargaining. Some individuals might use smoking as a reward or bargaining tool in various situations. For example, it could be used as a reward after completing a tiresome task or as a means of social interaction. In conclusion, smoking is a complex and multifaceted issue with cultural, social, psychological, and physiological impact. Psychological research can contribute to a better understanding of why individuals smoke and how they can break free from these dangerous habits. Temporary calmness. Some individuals might believe that smoking provides temporary relaxation. However, this relaxation is often a result of nicotine's impact in cigarettes, which stimulates the central nervous system and can lead to short-term sense of calmness. This effect is usually very short-lived and limited to the time of smoking. Changing focus and concentration. Some people think smoking can help them focus better and concentrate on their tasks. This effect also relates to the stimulating effect of nicotine in cigarettes, which can temporarily enhance focus in some individuals. Nevertheless, this effect is generally unstable and short-lived. In any case, it's important to emphasize that the destructive effects and risk of smoking generally overshadow these temporary benefits. Smoking increases the risk of cardiovascular diseases, cancer, respiratory illnesses, weakened immune systems, oral and dental issues, sexual problems, pregnancy complications, and many other health problems. For these reasons, it's recommended for individuals to avoid smoking to achieve better health. Smoking has numerous adverse effects on health. Below, I'll mention some of the drawbacks and risks of smoking. 1. Risk of cardiovascular diseases. Smoking increases the risk of heart and vascular diseases, including conditions like angina, heart attack, and aortic dissection, which can lead to heart attack and heart failure. 2. Risk of cancer. Smoking raises the risk of various cancers, including lung, oral, throat, stomach, liver, kidney, and bladder. 3. Negative effects on the respiratory system. Smoking leads to respiratory issues such as chronic obstructive pulmonary disease, as known COPD, including chronic bronchitis and emphysema, which result in severe breathing problems. 4. Decreased physical performance. Smoking reduces physical performance and fitness. Nicotine and other cigarette substances can negatively affect muscle and heart function. 5. Impact on the immune system. Smoking weakens the body's immune system, making individuals more susceptible to infections and diseases. 6. Dental and gum problems. Smoking can lead to dental and gum issues, including yellow teeth stains, bad breath, gum inflammations, and an increased risk of gum diseases like periodontitis. 7. Negative effects on fertility and pregnancy. Smoking has a detrimental impact on fertility and pregnancy. It can lead to ovulation problems, ovarian disorders, and an increased risk of pregnancy and childbirth complications. 8. Social and economic impacts. Smoking creates social and economic problems. Smokers might face financial issues due to the high cost of cigarettes and social situations due to smoking-related consequences. 9. Effects on close individuals. Smoking doesn't only impact the smoker's health, but also affects those around them. People exposed to secondhand smoke can experience adverse health effects. Furthermore, it's important to note that smoking is a strong addiction, and quitting can be challenging due to both physical and psychological effects. The best approach to maintaining health is to prevent starting smoking or to stop it altogether. Quitting smoking is a challenging process, but it can be successful with commitment and suitable methods. Here are some strategies for quitting smoking. 1. Firm decision. The first step in quitting smoking is making a firm decision to leave. Promise yourself that you won't smoke anymore and stick to your decision. 2. Professional counseling. Seeking advice from a doctor or a specialist in smoking cessation can be helpful. They can tailor suitable quitting plans based on your situation and guide you through the process. 3. Use of cessation aids. Nicotine replacement products like nicotine gum, patches, or lozenges can help gradually reduce nicotine consumption. 4. Medications. Certain medications can assist in smoking cessation. Consult with a healthcare provider before using drugs. 5. Psychological techniques. Practices such as meditation, mindfulness, breathing exercises, and positive thinking can help reduce the stress and anxiety associated with quitting smoking. 6. Support from friends and family. Loved ones can provide valuable support during this journey. Sharing your decision with them and asking for their help and encouragement can reduce feelings of isolation. 7. Avoiding triggering situations. Avoiding environments and situations that tempt you to smoke can lower the risk of relapse. 8. Finding alternative activities. Engaging in activities like sports, reading, arts, crafting, and hiking can replace the habit of smoking and keep you occupied. Remember, quitting smoking is a journey that requires patience and dedication. It's beneficial for your overall health and well-being.